Hi, my name is Monita Chatterjee, and I'm the director of the Auditory Prostheses and Perception Research Laboratory here at Boys Town National Research Hospital. I am excited to be presenting our recent work on voice emotion perception by children and adults with cochlear implants at the upcoming A.G. Bell NIH-sponsored research symposium. And I wanted to take this opportunity to tell you a little bit about this presentation that I'll be giving. Our lab studies the perception of sounds and speech by listeners with cochlear implants, children and adults. We have a strong focus on voice emotion perception because cochlear implants don't really transmit information about voice pitch very well as yet. They do a phenomenal job of transmitting speech information. So children and adults with cochlear implants today are very good at identifying speech, individual words within sentences, and understanding regular conversation in a quiet room or even with a little bit of background noise. However, the pitch-driven aspects of speech, such as voice emotion, are not very well transmitted. And I think we'd all agree that for full communication, we need to understand not just what was said, but how it was said. And so what was the mood of the talker? Did they ask a question, or did they mean to make a statement? So there's a lot that is conveyed by voice pitch fluctuations in speech. So as I'm talking to you now, you're not just hearing the words that I'm communicating, you're also getting a lot of information about my internal state, whether I'm upbeat or not, what kind of person I am maybe even, through the modulations of my voice pitch. So imagine if you didn't have access to that. That would really impair the level of communication, right, overall. So with cochlear implants, we consider a couple of populations and compare them. One is pre-lingually deaf children who were implanted very young, and they didn't really have a lot of access to regular acoustic hearing before they got this cochlear implant, and their brains are developing with this device in place. So they're developing their concepts of language and emotion and social cognition and general cognition through this degraded acoustic input. The other population we are very interested in is post-lingually deaf adults who developed these concepts of emotion and language and so on through normal acoustic inputs, and then lost their hearing later in life and are now adapting to this cochlear implant, this degraded input. So the children with cochlear implants might have an advantage in that they're implanted early on when the brain is very adaptive, whereas the adults with cochlear implants that we study are being implanted at a later stage of life when the brain may not be as able to adapt, but they have those established patterns of language and social cognition already through acoustic hearing. One of the things that we might consider is, well, why study voice emotion communication when a lot of information is conveyed through facial expressions? And it is true that we get a lot of information by looking at the person's face, but not everybody is as expressive in terms of emotions, and we don't always have complete access or good access to the visual cues that we might need for emotion recognition. Our talker might be located somewhere else off to the side, or in a classroom setting, other children might be seated around me, and I may not be able to constantly be moving my head around to see what they're looking like at the moment we're talking to them. And then, of course, there's things like telephone conversations and so on. So we have been studying voice emotion perception by children with cochlear implants and adults with cochlear implants. And I will be presenting to you data on how these populations do, especially with the children. What are the factors that might predict how well a child does in voice emotion recognition? And so, for instance, other than their developmental age, would the age at implantation matter? Would their socioeconomic status matter? Things like that. So I'm really excited to be presenting this work to you. I welcome you to our presentation, and I hope to see you there. Thank you.